Good day, lab mates. A laboratory possesses potential hazards due to the presence of dangerous chemicals, corrosive liquids, poisonous chemicals, and toxic gases. However, this should not scare anyone as the dangers can be minimized by adopting laboratory safety measures, which includes first aid procedures and supplies. First aid, as the name implies, is a set of guidelines and supplies which can mitigate the damage caused by the exposure to chemicals or injury before expert medical help can be provided. All those in the laboratory should be familiar with first aid practices, as this saves valuable time and reduces the extent of damage in case of laboratory accidents. Each laboratory should have individuals who have received the first aid training and have certification from local bodies. The following are the most basic first aid guidelines when encountering lab accidents in the different categories of hazards. First, chemicals spill on skin. Remove dry chemicals. Put on gloves and brush off any remaining material. Rinse the area of contact with a large amount of water for about 10 to 15 minutes. It is very important that water flushing starts immediately following skin contact with a chemical. It is better if complete water flushing occurs on site. Second, on the eyes. Don't accidentally flush chemicals into an unaffected eye. Hold the head so that the injured eye is on the bottom. Flush from the nose downward. Immediately wash the eyes with plenty of cool clean water to remove any solid or liquid chemicals from the eyes for 10 to 15 minutes. Third, cloaking. Chemical injuries, just like heat burns, continue to worsen as long as the source is in contact with the body. Remove clothing quickly to reduce the person's exposure to the chemicals. Ingestion. Take the victim to fresh air. This may mean going into another room or leaving the building. Remove anything remaining in the person's mouth. Perform rescue breathing or CPR if needed. Inhalation. If a person inhales chemical or toxic fumes, get the person into fresh air as soon as possible. Open doors and windows wide. If the person vomits, turn his or her head to the side to prevent choking or seek medical attention immediately. Burns and scalds. Hold the affected part under cold running water or immerse it in cold water for at least 10 minutes. For chemical burns, wash off the chemicals for 10 to 15 minutes. Constricting accessories such as bracelets, rings, watches, or clothing are to be gently removed from the injured area before it starts to swell. Cover the burned or scalded area with sterile dressing. Don't try to neutralize the burn with acid or alkali. This could cause a chemical reaction that worsens the burn. Consult a doctor if the burn or scald is not severe. Otherwise, bring patient to the hospital. Bleeding or cuts. Wash hands and clean the wound thoroughly with either antiseptic solution or soap and water. For antiseptic solution, povidone iodine or betadine, 10% solution may be used. Use gauze or cotton swab and wipe away from the wound to avoid contaminating it with skin bacteria. Use several swabs if necessary, using each one once only. Apply an adhesive strip dressing. Fainting. Position the person on his or her back and try to prevent someone who is fainting from hitting the ground. If the person is breathing, restore blood flow to the brain by raising the person's legs above heart level about 12 inches or 30 centimeters if possible. Loosen belts, collars, or other constrictive clothing. Apply a cool, wet compress to the person's forehead. Attempt to keep the person from standing up until fully recovered. If the person vomits while he or she is unconscious, quickly turn him or her to allow the fluid to drain while protecting the person's airway. Do not attempt to give unconscious person anything by mouth. Do not shake or slap a person who has fainted to attempt to make him or her regain consciousness. For safety reminder, all accidents must be reported to the faculty or laboratory personnel immediately, no matter how small it seems. All patients or victims must be brought to the clinic for further treatment.